Hello, dear friends. Let me extend my gratitude to Dr. Tade Batilno, Moshe Philip, and Benchi Sabu for this opportunity at the Diabetes India Symposium. Today, what I'm going to share with you will be the experience treating more than 950 children and adolescents with type 1 diabetes with telemedicine, WhatsApp being the telemedicine platform. And I'll be sharing with you the physician's perspective on merits and demerits of this program. I have no disclosures for this lecture. Before I start discussing the topic, let me describe the background. During COVID pandemic, of course, during the pandemic, telemedicine has become much more acceptable. Though it was there for many, many years, telemedicine became very popular among the physicians and patients all over the world, and it was widely acceptable throughout. About Kerala, where we live. This is a southern state in the country of India with 96.2% literacy. Yes, this is the most literate part of India. And thanks to this literacy, we could test a lot of such educational activities and execute such activities in our state. And for many years, for more than 2 decades, we have been successfully organizing diabetes awareness programs in the state, all over the state. And that have actually helped disseminate the messages, including the messages on type 1 diabetes. And this is the first state in India to recognize, the government has recognized type 1 diabetes as a separate entity, providing free medications and other accessories to a subgroup of patients. And those are the economically challenged patients with type 1 diabetes. And about our own telemedicine program, because that is so important when I'm discussing the WhatsApp platform for type 1 diabetes. We started originally a telemedicine-based follow program in diabetes way back in 1997. And this is our strength on realizing the merits, the demerits, and the challenges which we have extensively published over several years. So how is the functionality? This program, Diabetes Telemanagement System, consists of a multidisciplinary team. And this team, of course, consists of not only doctors, but also the team helping the doctors, which consists of dietitians, educators, nurses, and so on, all of them well-trained. And the patients are given the privilege of communicating with the team around the clock, and we will be assisting them on changing their dosages of medications in addition to the routine diet and the exercise advices. And this is also a platform where we will be empowering the patients on diabetes treatment, and we'll also be troubleshooting on devices. We'll be providing customized education and also ensuring multi-drug compliance. And this has been tested in all types of diabetes, in type 2 diabetes, in the prevention of hypoglycemia, in achieving the targets of therapy, in maintaining the hemoglobin A1C targets for many years. And success has been in more than 86% of patients enrolled in the program. And we have also published on the merits, the multiple challenges which can be expected, anticipated while running such a program, and the feasibility, the sustainability over many years, more than 15 years. Yes, this has been a successful model, which is there existing for more than 25 years currently. And this has also been tested in type 1 diabetes. In type 1 diabetes, during COVID pandemic, we have again realized that we can offer probably equivalent or better care. Yes, we can offer better care, and we can expect better outcomes even in type 1 diabetes. Of course, not just with telemedicine, but when telemedicine is practiced along with infrequent face-to-face visits. Of course, in Southeast Asia, we have our own challenges when we are managing type 1 diabetes. And I will say that overall, the challenges and the limitations could be the same wherever we live in the world. The challenges in treating type 1 diabetes are almost the same. And COVID-19 also taught us almost similar lessons. Wherever we live, we are all helpless human beings. And the war has also taught us the same lesson. And this is another story, the role of a multidisciplinary team-assisted technology-enabled education program, and how we were empowering the patients with type 1 diabetes and their parents on how efficiently and effectively they can execute the therapy and the advices. Telemedicine has been existing in our country for many decades. However, on the 25th of March 2020, the then Medical Council has published these guidelines. And this is an amendment to the existing guidelines. And this has made telemedicine practice much more flexible. Now we can use any platform, including WhatsApp, including Facebook Messenger. And it has become now very, very popular among the physicians and the patients. And this is our core team. Of course, only some of the members are there in this picture involved in type 1 diabetes care. And we were also for many years, we were trying to support the economically challenged persons, the families, the children affected with type 1 diabetes, with diabetes supplies, insulin, glucose meters, strips, needles, and a couple of them, we were even supporting them with insulin pumps and accessories. And whenever we get an opportunity, this is the establishment of Keshavdev Trust Type 1 Diabetes Program, the Sweet Stars Project in the year 2016. So in every opportunity, we were trying to disseminate the messages. Our objectives were very simple: to disseminate the messages to the public, to the media, to the patients, to the policymakers, to the governments, that type 1 diabetes is a different entity. Type 1 diabetes is a difficult to treat diabetes. Type 1 diabetes is different from type 2 diabetes, because what happens in India, even the teachers, they are confusing with type 2 diabetes and hence not providing the proper care and privileges to those students affected with type 1 diabetes. And then another major reason why we were conducting all these programs for the public were to ensure that this disease is not kept as a secret, because there used to be a tendency all over the country to keep the disease as a secret, not to reveal to the family members, not to reveal to the teachers and to the colleagues, resulting in premature death of all these children. So you have seen Dr. Scott Lee in the previous picture, and this is Dr. Robert Vygotsky. So whenever there is an opportunity, when the foreign faculty are visiting us, we will also conduct a program for the type 1 diabetes children, their parents. So they will get an opportunity to listen to the foreign faculty involved in type 1 diabetes care, so that the messages are made very simple and enforced. The type 1 diabetes is a treatable disease. Insulin is essential. Multiple daily injections of insulin are absolutely essential. The reason being, unapproved therapies and the use of alternative medications are very, very high in this part of the world. And this is another landmark in our state in Kerala, formation of a patient community. So we supported the formation of this community, and this was in the 7th of October in 2018, where the government officials also participated, the politicians also participated, and we supported the program for the formation of a patient community. So this is now the largest organization of patients and their parents with type 1 diabetes in the state of Kerala. And another program, so in every program, we made sure that there is a media attention and the news is getting published in the visual and the print media. And the same messages are spread powerfully, strong enough to reach the policymakers that the children need special care. The children, probably, most of them will require technologies for assistance. And they need multiple daily injections, and in the absence of injections, they are likely to die very soon. And this is another program where in the state capital, the minister also has attended. The health minister has also attended. And this is the special program of the government. So the government is also running a program, and it is a program where they are assisting and they are helping those disadvantaged children with type 1 diabetes. So let me now discuss the WhatsApp type 1 model. So that is the topic of the day. So in the WhatsApp type 1 model, of course, this has been existing for more than 4 years now. Even before COVID, this has been existing in the state of Kerala. And there are 4 WhatsApp groups. Approximately 250 patients are there in each group. And for small children, it's the parents who are the members of the team. And for grown-up, they themselves are the members. So let me tell you, these are not our patients. Our patients are different. Those visiting our hospitals are different. These are from the community. And they are getting treated in other hospitals, from government hospitals, from other private hospitals. But these are patients who are economically challenged and probably doesn't have access to the best of the hospitals or the doctors. And the group will consist of a multidisciplinary team. And these are doctors, the dietitians, the diabetes educators, the pharmacists. And what is our duty? What is our duty in those 4 WhatsApp groups? Our duty is not to provide them the treatment. Our duty is only to give them directions, to give them proper directions, and to give them proper advices whenever it is required. And this doesn't include all those patients in the state of Kerala. That I need to admit, because there are still maybe hundreds waiting outside, because we don't have a proper registry in India. And what were we doing? We were providing 24/7 support in the form of advices, and all these services were kept totally free of cost. We organized multiple online educational programs, because during COVID, we couldn't have the face-to-face program. So we were actually organizing multiple programs via the Zoom platform. And most of them for parents and for children together, and some of them only for parents. And we soon realized the importance of involving a psychologist, that we soon actually realized. And in each WhatsApp group, we made sure that in each WhatsApp group, there is one person on duty. And this is very similar to the duty roster in the hospital. So in the hospital, there will be a doctor and nurse on duty all the time. So similarly, in the WhatsApp groups, there will be somebody who is an expert, who will be answering to the questions, who will be addressing the concerns 24/7 without any delay. And these are some of the commonly asked questions. I am pretty sure that whoever is listening to my lecture will agree that these are the same questions from anywhere in the world. My glucose is pretty high, what to do? My glucose meter strips are over, my insulin is over, what to do? And in those occasions, we will try to manage from a nearby medical shop, or somebody who is there in the same WhatsApp group will also provide them with the insulin or the accessories, or we ourselves within 24 hours will make sure that we will provide them with the necessary medications or accessories, and that too completely free of cost. But some concerns are difficult to address. For example, when the child is violent or aggressive, a child who is having an acute abdominal pain or an urinary infection, menstrual abnormalities. And during the COVID pandemic, many children were reluctant to have insulin injections and not willing for glucose monitoring. So all of those situations we used to address. And we organized exclusive counseling sessions with psychologists. And this is a screenshot of one of those programs where a psychologist is addressing. This was meant only for 1 hour, but it went on for more than 3 hours with more than 400 participants. And we were actually forced to conduct similar multiple programs during the COVID pandemic. And going by the frequently asked questions, we decided to create videos. So we created videos, some of them only for the WhatsApp, and some of them we posted in the YouTube, because most of these questions used to get repeated, either from the same person or from a different person. Because post-pandemic, we have realized a huge increase in the number of new patients diagnosed with type 1 diabetes. So let me now briefly discuss The merits and demerits of this program. What are the merits and demerits of providing a WhatsApp advice via telemedicine, involving celebrities for education, involving psychologists for group education, providing WhatsApp video calls for addressing specific issues, and so on. So merits are many merits are there. All the concerns were addressed, even during the middle of the night. And the patient satisfaction, the parent satisfaction is very high. We could avoid multiple episodes of diabetic ketoacidosis. We could successfully avoid multiple episodes of hospitalizations due to hypoglycemia. And our dietitians could not only advise general diet, but also could specifically address the diet, and that too specific for the medications, age, and other parameters. And we could successfully, I would say, avoid hundreds of hospitalizations before and especially during the pandemic. And other merits, the diabetes nurses, they were training and retraining via the WhatsApp video on injection techniques, on the use of glucose meter, on the rotation of the injection site, and so on, multiple times. And they were, I would say that they were having a very high level of patience. And the questions on, can I stop insulin? Multiple times, despite almost 100% literacy in the state, still there are patients getting attracted to alternative therapies. Even the government is having advertisements and promoting alternative medications such as Ayurveda, Siddha, Unani, homeopathy, and so on. And many people still believe that diabetes can be treated via other systems of medicine. So we need to explain to them. And then whenever there is a shortage of glucose meter or strips or insulin or other accessories, either they will get it from the same group or from the society officials or from us, completely free of cost without any delay. And all these services, I would say, including the advices, were provided totally free of cost. And our success, I would say, apart from WhatsApp messages and apart from the voice messages, I would say that much more efficiently we could communicate. All the members in the team could communicate via WhatsApp video calls multiple times, troubleshooting on devices and injection techniques. But this program is also having multiple demerits. The patients are not originally our patients. They are from the community. And these patients with type 1 diabetes are getting treated in different hospitals from all over the state, and not by the volunteering doctors and nurses. And hence, we don't have their medical history. We don't have their electronic medical records. And many a time, the patients with uncontrolled glucose or with recurrent episodes of hypoglycemia will be on a regimen or an insulin formulation not suitable for them. And we cannot comment. We cannot comment on having multiple daily injections. And these are circumstances where we will be very diplomatic in making suggestions, in having a discussion with their own doctor. Hundreds of patients will be messaging and calling the doctor via the WhatsApp or because the phone number is public. I think that is a major demerit of this program. They will have a direct access to the doctors and the nurses in the hospitals. And due to legal implications, we don't reply to the personal messages. Of course, there is no hesitancy from the group to have any discussion in the community, but there are many concerns and questions. Which cannot be probably posted in a group. And since it is an open community, whenever communications are exchanged, including some confidential messages such as lab reports, they are not secure. They are never secure. It is always public. The healthcare providers will not get a remuneration. And this is probably a challenge. If some of you are planning for replicating this model, and there is absolutely no funding available for running this program currently. So all the members are currently volunteering out of their commitment to the society. But experience has actually taught us a lesson that this can seriously impair with the routine responsibilities in our clinic and hospital, since the burden is huge and demanding from this community. Not all the time, but most of the time. And this WhatsApp model for type 1 diabetes, of course, is not based on any sophisticated technology or artificial intelligence. And the patients still, I know, they believe in having live conversations, and they are probably not satisfied with the mobile apps or with the recorded conversations. Once in a while, they would certainly like to have live conversations or video telemedicine. So it is justified to explore reasons for failure in an existing system, which is running for several decades, and adopt viable technology integrated solutions for successful care. So thank you very much for the patient listening and for the opportunity.